right. Good morning, everyone. Thank you for joining us today. My name is Elise Wallenberg. I am the lead pharmacist with EMO Health, and I am pleased to introduce Allison Burns. She is the president and CEO of EMO Health. We're so excited to present to you part 5 of our BSAS webinar series today. We're going to talk about over-the-counter medications and dietary supplements. We'll get started now and we'll take questions afterwards until around 10:30 or 11 a.m. And I think, Allison, let's get started. Thank you very much again for joining.
Good morning, everyone. We're going to jump right into this. In case there are questions at the end, we will be answering those. And thank you, Elise, for introducing me. Again, the topic today is going to be over-the-counter medicines, also known as OTCs, and dietary supplements. So nothing to disclose financially. And we, of course, want to give special thanks to our partners at BSAS and the Massachusetts Department of Health in partnership with the CDC. Our learning objectives for this webinar are going to be to describe how to properly store, observe, and document over-the-counter medicines and dietary supplements, identify where to find information about both dose and directions on a drug facts label and supplements facts label, interpret expiration dates that are formatted as month, year, and explain how to handle house-supplied OTC medicines. So what are non-prescriptions? Vitamins, supplements, and over-the-counter drugs, also known as OTCs, are an important part of self-care for many Americans. They can all be purchased in a store off the shelf without a prescription. And since they are packaged for the general public, information about how much, when, and how long to take an OTC drug or supplement can sometimes be confusing. And for this reason, it is critical for congregate care workers to understand how to document, store, and support residents who are taking these products. To put it in perspective, when we're thinking about what is exactly out there, currently there are over 300,000 over-the-counter drugs on the market approved by the FDA. All of these have 3 central components. They have a short duration of use. Typically, these are going to be less than 2 weeks. Most of them are less than 7 days. And after that point, it will say on the back of the box that you should reach out to your healthcare provider to be checked. They all are used to relieve symptoms of self-diagnosable or minor ailments. So, for example, a headache, a stomach ache. They're not going to be used to treat major diseases. And they are typically come in lower doses and are less potent than prescription medications. In terms of dietary supplements, there's actually over 29,000 of these that are available in the United States. And on average, we are having 1,000 new products being introduced each year. These products include anything with what is considered a dietary ingredient. So that's vitamins like thiamine and folic acid. Those are actually both vitamin B. Minerals like calcium and iron, herbs and botanicals like echinacea and garlic, amino acids like L-lysine, coenzyme 10, which is an enzyme, and other substances to support health like melatonin, fish oils, probiotics, and protein powders. This chart visually explains the difference and similarities between the 3 different categories here. So I know we've spent a lot of time talking about prescriptions. These all require a doctor's order or a prescription, and they're used by one person for a specific reason. They're bought in a pharmacy and they are dispensed with a prescription label. And an example of that is going to be fluoxetine, which is brand name Prozac. On the other hand, today we're going to focus on these 2 on the right. These are non-prescriptions. So OTCs and dietary supplements, they don't require a prescription. However, they can still be prescribed or recommended by a healthcare provider. They're used by the general public for a variety of reasons. They're bought in a store or online. The OTCs are going to be labeled with drug facts, and the dietary supplements are going to be labeled with supplement facts, which is very similar to a recipe book. And a good example of an OTC is ibuprofen, brand name Advil, and a dietary supplement would be a multivitamin. One thing I'd like to point out is when you're thinking about what is and what is not a drug, the FDA made it very easy for us. So, obviously, prescription medications are drugs. OTCs are regulated as drugs. Hence, the FDA requires them to be labeled with a drug fax. And then, if it's can be purchased without seeing a healthcare provider, they were very easy. Instead of having an official label, they have a fax. So that is why drug fax and supplement facts are on the back of those packages. So, what's the difference between all of these things? OTCs are approved and regulated by the FDA, as I just said, as drugs. They're labeled with their drug facts and they have a recommended daily dose. Dietary supplements like vitamins are regulated by the FDA as foods. They are labeled with supplement facts and have a recommended daily serving on the package. Dietary supplements are not required to prove they're safe or effective or work for any health condition, and thus they must be labeled with the FDA disclaimer on the bottle, and it will look like this. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease, and that will appear on every single supplement. So the FDA is actually not responsible for ensuring that the ingredients listed on a supplement label are actually authentic, accurate, or uncontaminated. Studies have shown that only 48% of supplements had any of the herb or ingredient listed on the label, and more than half had fillers or substitute ingredients that weren't on the label at all. And there is at the bottom, you can see the reference for that specific study that I am referring to. And it's important to remember that a nutraceutical isn't the same as a pharmaceutical, and natural does not mean without risk. The easiest way to remember this and to teach our residents is drugs are considered unsafe until proven safe. They go through clinical trials, they go through human studies. Dietary supplements are considered safe until proven unsafe. I mean, they are brought to market, and at that point, if there are multiple reports of unsafe things happening, the FDA can ask that manufacturer to pull that supplement from the from the market. So one example that has happened before is some of the dietary weight loss supplements had been pulled from the market because of the negative effects that they've had because they've been proven unsafe. For safety reasons, we want you to encourage your residents to buy from reputable sources, such as the local pharmacy, grocery store, vitamin shop, GNC. We would say online purchases should be avoided, again, unless it's coming from a reputable source. We want to make sure that people aren't getting any counterfeit or fake products. A good way to figure out if it's a safe product is look for that third party verification on the bottle. So there are 3 pictures at the bottom: NSF, USP, Consumer Lab. These 3 pictures, think of them like brands. And these pictures, as you can see on the multivitamin in the right corner, they're going to be printed on the bottle. These are third parties that tested the ingredients and make sure that what is on the bottle is actually in the bottle. So if you see any of those 3, that is going to mean that you probably have a very safe product. So given all of these risks, why would anyone even take a supplement? So supplements do still have a place in treatment. In fact, most people, although they get enough nutrients and minerals from eating a healthy, balanced diet, others are going to need additional support, and their provider may prescribe or recommend a supplement. For example, individuals with alcohol use disorder may be deficient in vitamin B and will be prescribed a vitamin B complex. And this is because alcohol actually interferes with the way that nutrients are absorbed in our body. So, fairly often, they may be deficient in vitamin B. And in fact, vitamin B1 is so important, thiamine, it's used to treat Wernicke's encephalopathy, which is an acute and potentially life threatening neurological disorder that is caused by alcohol use. So, again, supplements do have a place and they are still important part of self care. Now we're going to do audience participation. Okay, a resident was recently told by her doctor that her vitamin D levels were low. He told her to pick up Caltrate, which is a supplement that contains both calcium and vitamin D at the local pharmacy on her way home. So as you can see, the package is right there on the right. How should the program handle the Caltrate? A, it's a supplement, so the program doesn't have to check it. B, it's an over the counter, so let the resident take it to her room. C, Caltrate was recommended by a doctor, so put it with the resident's other medicines, no need to document anything. Or D, document the Caltrate on the appropriate form or medication sheet and store it with the resident's other medicines. So we will give you guys maybe 30 seconds to think about your answer. You can throw them into the chat box.
All right, Allie. Again, an overwhelming number of Ds.
And D is the answer. And I want to let everyone know that next month's topic is actually how to interpret and read labels, and that also includes the OTCs, dietary supplements, as well as prescriptions. So we'll dive into that a little bit deeper. But for the purposes of this webinar, we want to go over the principles of storing, documenting, and observing those OTCs and supplements. Here is just a reminder of what the regulations are if you want to look them up. The most important one that applies to us with this first part of the webinar is actually part D, where it says all over-the-counter medication shall be kept in the original containers containing the original label, which shall include the directions for use. All right, so what are the requirements for OTCs? They must be packaged in the original container that's labeled with the drug facts. The original container means that container that it was originally purchased in. It must be stored in a locked area. It may be secured in the same area as the prescription medications. It is tracked on a medication sheet or record. It can be, again, for convenience, it can be the same form that you use to document your prescription medications, and it should have the following information. So to make sure the name of the patient is on there, the name of the OTC drug, the suggested or recommended dosage, the directions for use, the date and time and quantity that was actually taken, and then, of course, the signatures of the patient and the observing staff member. These three items right in the middle, so the name of the drug, the recommended or suggested dosage, and the directions for use are going to be transcribed directly from the original container. So it's very important, again, to keep that container. Dietary supplements, same exact way to handle them. They must come packaged in the original container, labeled with the supplement facts. How do you know if it's the original container? If you flip it over and there's no supplement facts on there, the FDA disclaimer is not there, it's not the original container. They're required by law to always have supplement facts on the back. Again, stored in a locked area. It may absolutely be secured with your prescription medications for convenience, and it is tracked again using a medication sheet or record, maybe the same exact form that you use for your prescription meds, and it will have the following information. So make sure you have that name of the patient, so whoever is taking it, the name of the dietary supplement, the recommended or suggested dosage, directions for use, date, time, quantity taken, and the signatures of the patient and observing staff member. Again, these three items in the middle, the name of the supplement, whatever that recommended or suggested dosage, and the directions for use are all coming right off that original container. Storage requirements. So the original container must be labeled with the complete directions for use and the suggested amount that can safely be taken in one day. The FDA does require this, so you shouldn't have to really go searching for it. Typically, it's going to be on the back of the box, the back of the package, back of the bottle. Keep in mind that blister packed pills like the Mucinex that is on the right side of your screen, those must be kept inside the original boxes. So don't throw out that Mucinex box and just have those blue blister plaques, because you're not going to, one, it's not in the original package, and you're not going to have a lot of important information on there. That also includes the directions. It includes when it should when it expires, and when you should reach out to your doctor. Anytime that you have a container that's presented that's either unlabeled, partially labeled, or illegible, so meaning it just can't be read, those should be really removed and disposed of from the program. Those products that aren't properly labeled, they could be unsafe or even counterfeit, and we really can't be taking guesses about how someone should be taking an over the counter drug or a supplement. And again, these original containers actually have a lot of useful info: expiration date, how long to take the medicine before calling a healthcare provider. So on the back of the OTC packaging, it's going to say after 7 days or after 14 days. If your symptoms don't resolve, reach out to your healthcare provider. It's also going to give you very important information about who can and who should not take this OTC. So there'll be a section, we're going to go over this, where it'll say, for example, might not be appropriate for people who are breastfeeding or pregnant. It's going to give that information to you on there. So here's some examples. As you can see on the left side of the screen, yes, here we have a chloroseptic, which is a OTC lozenge for sore throat. As you can see, there's the package. It's got the drug facts right on the back. Then you've got the vitamin that's next to it, supplement facts right on the container. What you don't want to have is anything that's on the right side. So an unlabeled bottle, a loose pills in a baggie, or just the loose blister packs. So they're not actually in the original box. So how do you observe these products? All right, they must be taken according to those labeled directions on the original container unless otherwise directed by a healthcare provider. And typically, this is up to the program. If you want to get in contact with a healthcare provider, it is up to the program how they'd like to handle that, whether they are going to get that information in writing or however they'd like to receive that information from the healthcare provider. But in the event that someone is given additional instructions from their healthcare provider, then you would go with those. All OTCs and supplements should be taken in front of the staff, meaning they're observed exactly the same as your prescription meds. They must be properly documented each time that they are taken in front of the staff. Of course, our medicines that are applied to genital areas or are otherwise inappropriate to be observed by staff may remain in the resident's possession. When we're thinking of those types of medications, examples would be, for example, Monistat, or which is used for vaginal yeast infections, or potentially a cream that is used for hemorrhoids. These aren't applied in front of staff, they're not observed by staff, and we would not expect that. So those can remain in the resident's possession. Anything that does remain in the resident's possession, you still need to document the date and the quantity of that product that went up. So, say it is Monistat, you would document somewhere that it was Monistat, the quantity that went up, the date it went up, and that's what's remaining in the resident's possession. You do not need to document, though, each time it is taken in private. This is what a drug facts label looks like. Good news is the FDA made it very convenient, so everything always is in the same exact order on every single package. The very top, you're going to have the active ingredients, which are the ingredients that make the medicine actually work. You're going to have the uses or indicated uses, and those are the symptoms that the medication is treating or relieving. Next, you're going to have the warning section. That's going to include your side effects, when to reach out to a healthcare professional, especially before taking a medicine, and which other medicines should not be taken at the same time, and also when to stop use. Then you're going to have your directions. That is going to be the amount or dose of the medicine to take, how often to take it, and how much you can safely take in one day. So that's your maximum daily dose. Other information that's going to be important things to know, such as how to store the medication. Inactive ingredients, this is going to include your flavoring, preservatives, or any other ingredients that, although are in the medication, they're actually not meant to treat the symptoms. So if somebody has an allergy, maybe to red dye, gluten, they're going to want to check there to make sure that none of those ingredients are actually in the medicine. And then in the questions or comments at the bottom, there's going to be a phone number to the company or the drug manufacturer if you have questions about the medicine. Again, here's what a drug facts label looks like. FDA requires it every time to be printed the same way, same exact sections in the same exact order. The ones I want you to really pay attention to is the active ingredient, because that's where you're going to look for the name of the medication and the strength. course, we went over the uses, the warnings. The next section I really want you to pay attention to is the directions. So that's where you're going to look for the dose and the directions. Other information, inactive ingredients, and your questions or comments. So here is an example. So we have Advil. It's brought in. Here's the bottle off to the right, 200 milligram tablets. So I snipped the little drug facts here. At the very top, you've got your active ingredient. Okay. There it is. So you have the name. So right off the front of the bottle, of course, you could see that it's ibuprofen tablets, it's Advil. If you look on the back, you can see the official generic name of the ingredients are inside. So ibuprofen, and how much is in each tablet? 200 milligrams. So you now have the name and the strength. Then if you go down to directions, there you go. You have what the directions are for adults and children 12 or older and children under 12. For us, of course, it's going to be the adults and children over 12 years old, and you can see the directions there. So you're going to write down take one tablet every 4 to 6 hours while symptoms persist. And then I would absolutely suggest putting on there the maximum daily that can safely be taken in a day. So do not exceed 6 tablets in 24 hours unless otherwise directed by a doctor. You can also put in there if pain or fever does not respond to one tablet, two may be used. That's absolutely fine. It just depends how much room you're going to have on that medication sheet or form that you're using. The most important part is make sure you have that take one tablet every 4 to 6 hours and the maximum that can be taken in the day, a single day, which is 6. Again, just went over the maximum daily amount. So that's important for safety reasons. How to find dose and directions on supplements. Again, these are foods, they look a little different. Since they are considered foods, they look very similar to nutrition facts, the kind you'd see on the back of a box of cereal or on a loaf of bread. For supplements, the serving size or the suggested use, that is going to be where you find the dose and the directions. So here, the serving size, here you go. We have that Caltrate again that was brought in by the resident. And on the back of that bottle, it says the suggested use. That's our directions. Here it's take one tablet up to 2 times daily with food or as directed by your physician. Take with a full glass of water. It's not for use in children. On your medication sheet, you could simply write take one tablet up to 2 times daily with food. And as you can see, it says, what is the serving size? So that is one tablet. That's your dose. Expiration dates, very, very important. Sometimes hard to find, but proactively check for these expiration dates. What we would recommend is check for expired resident medications at admission, and then every time that they bring in or present an OTC vitamin or supplement thereafter. And then if you have house supplies, we'd recommend checking for those monthly. Best case scenario is assigning a staff member and then setting a schedule. So you assign one person, this is their duty, and they check it the last Friday of every month, or maybe they check it the 31st or 30th of every month. However you want to do it, setting a schedule is probably the best way to remember. If the expiration date cannot be located on the package or it cannot be read, the product should be disposed of. The expiration dates are usually written in the month/year format. When no day is given, it means it expires the last day of the month. So for example, 05/21 means it is expiring on May 31st of 2021. And this is also true for prescription medications that are formatted as that month, year, just so you know. Now, a program may allow OTC drugs and supplements at its discretion, meaning you can decide which ones that are acceptable in your facility. However, a program cannot deny any prescription medications. So what this means is the program is going to be required to accept any OTC drug, vitamin, or supplement that is prescribed by a healthcare provider. Even though it's available over the counter, if it's prescribed, it cannot be denied. A best practice that we're recommending is to reduce any confusion among staff and residents, create a standard list of acceptable non-prescribed OTCs and supplements, and then post this list in a visible place such as the med room. And we'd say, think about it in 2 different ways. what OTCs, if you're not going to allow certain or you're going to restrict certain OTCs, think about which ones are going to be allowed in the program and then which ones of those are going to be allowed to remain in the resident's possession. So here's some examples, some common products that are acceptable for use in residential settings. There are, again, 300,000 over the counter products out there and 29,000 supplements. So the list can go on and on. It's up to the program how they want to handle these. But here are just some common examples that we've seen allowed in most residential settings. So the lactase enzyme, Lactaid, Docusate, which is Colase, Senna, Senecot, and then the combination of the two, Docusate, Senna, which is a brand name Senecot S or Senna Plus. Those are used for mild constipation. Calcium carbonate, which is brand name Tums, it's used for a sour stomach, digestion problems. Simethicone, which is Gas X. Pain fever reducers like ibuprofen, brand name Advil or Motrin, and acetaminophen, which is brand name Tylenol. Antifungal medications used for vaginal yeast infections, jock itch, and athlete's foot. So these include Lotramine and Monostat. Then multivitamins and prenatal vitamins. Again, this is just a very short, truncated list. There are many options out there, and it's up to the program to decide which ones they want to accept at their discretion. So, how to handle an OTC or a supplement. Here's the easy steps. One, keep it in the original bottle. If the resident brings in loose pills or an unmarked bottle, get a supervisor. Check the expiration date. If it's expired, let the resident know it's unsafe to take and offer to throw it away for them. Three, locate those directions on the container, typically going to be on the back. Four, fill out that medication sheet or medication administration record and store it securely with the resident's other medicines. You cannot store it with the house supply. And if the resident wants to retain possession of that medication, then check with a supervisor, or if you have a list of acceptable OTCs that are allowed in resident rooms, you check that list. Safe use of OTCs and supplements. Be safe, talk before you take. Any OTC drug, vitamin, or supplement has the potential to cause harm. Any of them can cause an allergic reaction. They can interact with your prescription medications and limit their effectiveness. There's a potential for overdose. And they might be inappropriate for individuals who are pregnant, breastfeeding, have kidney or liver issues, heart disease, or other chronic health conditions. These risks are often increased if you take more than one product at a time, or if you take a combination product, meaning one product that contains multiple drugs or ingredients. Remember that medications, vitamins, supplements, the way that our body breaks them down, metabolizes them, is usually through the kidney or the liver. So if someone has kidney or liver problems, they might be exposed to more medication than someone else. So when we're looking at these potential risks, sometimes when we take an over the counter product, we are delaying professional medical care because we're masking symptoms of a larger health issue, which is why they limit it to a short duration of use and say after 7 days or 14 days, make sure you get in touch with a healthcare provider to make sure nothing else is going on. Sometimes they make our other health conditions worse. So, for example, the supplement St. John's wort interacts with many medications and may trigger mania or hypomania in bipolar disorder. Some of our heartburn, cough, cold, and sinus medicines are very high in sodium, which is salt, and that can actually exacerbate heart disease. So, a good example of that is actually Alka-Seltzer Plus contains 476 milligrams of sodium per tablet, which is quite a lot. They all can cause side effects. So, examples anti-inflammatories like Advil, Motrin, and Aleve. They can actually cause stomach bleeding, ulcers, and kidney damage if taken for an extended period of time or if more than one is taken at a time. Sometimes they can make our symptoms worse in the long run. So, example, Afrin nasal spray, it actually, initially, you might want to break up that congestion you have, but it actually can cause rebound congestion if it's used for more than 3 days. Sometimes these make our medications less effective. So, vitamins and minerals, they actually prevent certain antibiotics from being absorbed in our body. Nasal decongestants like Sudafed, so pseudoephedrine and phenylephrine, and many allergy, cold, and flu products actually raise blood pressure and they counteract those medications that are used to lower blood pressure. So we want to avoid those in anyone with hypertension. So, a good way to approach these is make sure, read that label very carefully. Make sure the resident understands the directions and any warnings on the label that might apply to them. Those active ingredients, and the reason for that is a resident may be taking more than the recommended amount or maximum daily dose if they're taking different OTC medicines containing the same drug. I'm going to give an example of that later in the slides, but where I'm going with this, if you're taking multiple medications and you might be taking them exactly as directed on that package, but combined that actual drug, you have now exceeded the daily recommended amount. And the two products that I want you guys to pay attention to is acetaminophen and diphenhydramine. So I'm going to give examples of those. And again, talk before you take. So strongly encourage the residents to talk to their healthcare provider or the local pharmacist before starting an OTC or a supplement. All right, audience participation. What do the three over the counter products below have in common? So you have Unisom, Tylenol Severe Allergy, and Midol PM. So A, they're made by the same drug manufacturer. B, they contain the same medicine but are marketed under different brand names. C, they can only be purchased in pharmacies. Or D, they can only be used by females. We'll give you guys about 30 seconds to make a selection here.
All right, Allie, we've got some B's here.
Yes, the answer is B. So there are the three packages. They're actually the same medicine, they're just marketed under different brand names. All three contain the same exact medication. So they all contain acetaminophen plus diphenhydramine, which is acetaminophen, active ingredient in Tylenol, and diphenhydramine, mainly known as the active ingredient in Benadryl. So, three very differently packaged medicines used for different symptoms but contain exact same ingredients. So here's an example of someone, if they were taking these three, they would exceed the daily recommended amount of each of those drugs. So many medicines, same ingredient. Diphenhydramine, which I just explained, is mostly known as being the main ingredient in Benadryl, is actually in over 200 over-the-counter medicines, including those for sleep, pain, allergies, cold, cough, flu, and motion sickness. It's often the active ingredient in any type of product that's labeled with PM or nighttime. And again, taking multiple medicines that contain diphenhydramine can cause daytime drowsiness and increase the sedative effects of other medicines. On the other side, there is acetaminophen, which is the mostly known as being the main ingredient in Tylenol. And it can really be listed as a pain reliever on one package and a fever reducer on another, but it's also the same ingredient. The residents with hepatitis C or any liver problems are going to be at a higher risk of serious injury. Just so everyone knows, acetaminophen is actually in more than 600 over the counter and prescription medicines. And acetaminophen toxicity is actually the leading cause of liver failure in the United States and the second most common cause of liver transplants worldwide. On average, it causes 56,000 emergency room visits, 2,600 hospitalizations, and 500 deaths per year in the United States. And 50% of these are unintentional overdoses. So it's going to be very important if someone is taking many products, including the ingredient acetaminophen, that we're looking at those carefully and making sure that they're not taking more than the recommended daily dose. You've got to really read those labels carefully, especially with our combo products. So here's some examples of 4 combo products. Many times, just because there's not enough space on the label, they're going to use some abbreviations as part of the name. If you see APAP, so APAP, that stands for acetaminophen. If you see D, as in Delta, it's actually for Sudafed, for pseudoephedrine. So if you see on the bottom Claritin D, that actually has pseudoephedrine in it. It's not just the loratadine in that combo product. If you see DM or DXM, it stands for dextromethorphan. So you can see that on the Robitussin cough syrup there. If you see PM, going to stand for diphenhydramine, which you can see at that Motrin PM at the top. And then PE is another form of a nasal decongestant. It's phenylephrine, and you can see that the middle product where it says Sudafed PE, that actually contains acetaminophen and phenylephrine. That Sudafed product does not contain what normal people consider Sudafed, which is pseudoephedrine. So you got to really read the labels carefully and make sure that everyone understands what's on the back of that package. Sometimes a combo product isn't always needed, and unnecessary medicines create unnecessary risks. So if you just have, a sore throat, you don't have to get that multi-symptom medication. You could just get something that's for sore throat. Again, these combo products contain sometimes 4 different medications in them. And if you don't need to take all 4, then you don't want to expose yourself to any risks. Some OTCs have psychoactive effects when taken in large quantities and can contribute to a resident destabilizing if not taken as directed. There's 3 in particular that we want to point out. So dextromethorphan, you might want to consider making this accountable. It's in over 100 OTC medicines for cough, cold, and flu, such as Robitussin, Dayquil, Mucinex DM. These are actually age restricted. The sale is prohibited to minors in Massachusetts. That's a state law. It requires a license to purchase and is kept behind the pharmacy counter because it has a potential for misuse. Pseudoephedrine, which is and many cold, flu, and allergy medications, such as Sudafed. It is quantity restricted by federal law and again requires a license to purchase. It is tracked by your license and is kept behind the pharmacy counter due to potential misuse. And then loperamide, which is the anti-diarrhea medicine most commonly seen in Imodium. So these 3 in particular, we would suggest that you consider making those countable because they do have a risk of being misused. Requiring medical documentation. So OTC medicines and supplements can be purchased without a prescription. So therefore, a doctor's note, healthcare provider's order, or pharmacist authorization is not required to take these products. However, the program may require such documentation and or restrict the types of OCT medicines that are allowed in the facility at its discretion for all the safety reasons that we have already described. Just keep in mind that requiring documentation may limit access to FDA medicines that were intended to be taken without a doctor's approval. That's why they put it over the counter, and they also can increase healthcare costs. So extra doctor's visits, extra prescriptions, that's all going to boost up healthcare spending. So of course, you can require documentation at your discretion or restrict the types, but do keep in mind that if you're going to apply that, you're applying it to the whole 300,000 OTCs, and you have to look at is that limiting access to medications that are very important for people to have access to over the counter. So again, we're thinking of things like Plan B, which is emergency contraceptive, any of your vaginal yeast infection medications or antifungal medications. Some medications are used for lice, things that actually were prescription at one point, like Prilosec and Flonase, and those have been moved to over the counter. They have been moved by the FDA from behind the counter to over the counter to increase access. So just keep that in mind. All right, one more question. John, a resident at your program, takes Tylenol daily as needed for knee pain. He hasn't been feeling very well, so he picks up Dayquil, cold and flu, which also contains acetaminophen. Are there any safety concerns? A, no concerns. Both products are available over the counter and are relatively safe. B, yes, both contain acetaminophen. Tell John he cannot take the Dayquil. C, yes, both products contain acetaminophen. Review the directions with John. document the maximum daily amount that can be taken of both medicines, and ensure that John understands how to take this safely and support him in calling his provider or pharmacy with any concerns. Or D, yes, both products contain acetaminophen. Tell John he must choose between relieving his knee pain with Tylenol or his cold symptoms with Dayquil. So we'll give you about 30 seconds to answer this one.
All right, Allie, it looks like we got a lot of C's on this one.
Yes, the answer is C. So here are the two packages, Tylenol, and there are the directions for that in the right corner. So Tylenol contains, if you flipped over the box, it contains 500 milligrams of acetaminophen. That's in that active ingredients part at the top. And in the directions, it says take 2 caplets every 6 hours. While symptoms last, do not take more than 6 caplets in 24 hours. John went and picked up Dayquil because he's not feeling too great. It is one of those multi symptom relief medications, so it does contain a lot of other ingredients in it. Not just the acetaminophen, but it has also the phenylephrine. It does have dextromethorphan in it. But we want you to really pay attention to the acetaminophen here. So the Dayquil contains, if you flipped it over on the back, it's going to say it does contain 325 milligrams of acetaminophen. And the directions are take 2 caplets with water every 4 hours. Do not exceed more than 8 caplets per 24 hours. So if John took these exactly as they are written on the back, he would actually be taking 5,600 milligrams of acetaminophen, and he is at serious risk of overdose and liver injury. So the way you do this is the Dayquil, if I'm allowed to take 8 per day, so 8 times the 325, and then if I am allowed to take 6 times that 500 milligrams, you're going to get a total of 5,600 milligrams. And that actually significantly exceeds the daily recommended dose for over the counter products, which is 3,000 milligrams. Individuals with chronic hepatitis, hepatitis C, or any type of liver disease, they actually are supposed to take 2,000 milligrams a day. So you have to keep that in mind for any of those patients. One really important part of self-care and recovery is teaching practical medication skills. So teaching our residents how to look at the maximum daily dose and making sure they understand it refers to all sources of that drug is going to be important for them to have that skill to take with them when they do leave the program. So house supply, program supply. If your program provides supplements or OTC medicines like ibuprofen to residents, make sure that you have the following safety standards in place. So they've got to be locked up and stored separately from those resident medicines. They should still be taken in front of staff, meaning observed. They've got to be documented every time it's taken. For privacy reasons, you might want to consider having each resident on their own medication sheet because you really shouldn't know what medicine someone else is taking. The directions for use have to be clear and transcribed correctly from the drug facts label. Of course, this is where, again, it might be beneficial for you. You have to make sure let's put it this way, if the directions aren't on the sheet, you got to make sure that the resident has access to those. So if you want to post somewhere that this is the house supply and this is the suggested directions and maximum daily dose according to the drug facts label, that's fine. But if the patient doesn't have access to the bottle and does not know the directions for use, then it can lead to a med error or patient harm. So you got to make sure that they do have access to those directions or that they're posted somewhere and that they understand those directions. If you are actually documenting it on single sheets, it is nice to have one house supplied medicine per sheet, especially if that house supplied medicine is a multi symptom product. because there's going to be multiple different ingredients on there. If more than one product is tracked on a single sheet, there's got to be a clear, separate space for multiple sets of directions. So, again, the resident doesn't get confused about how much they can take of each product. Best practice to prevent, overdosage or medication error is consider including that maximum daily dose right off the back of the bottle. Here's an example of how something could be documented. So you could put house ibuprofen. Take one tablet every 4 to 6 hours as needed, maximum 6 tablets per 24 hours. Again, this could be posted near that house supply, somewhere in the med room, or it could be on an individual sheet. Again, each patient is going to possibly take it differently. So one day someone could take 6, another day someone could just take 1. So again, you're going to want to make sure that you are recording the quantity that they're taking to make sure that there's not, we don't want an overdose to happen. And then make sure that they understand that the daily limit includes all the sources of ibuprofen. So that includes the resident and the house supplies. Takeaway points: supporting our residents taking these medications correctly. So, when a resident takes an OTC or a supplement incorrectly, consider reviewing the directions with them and using a teach back method. Ask them, tell me how you take this medicine, or can you explain to me how you take this? When the resident's symptoms are not relieved, or they want to take more than the recommended amount or maximum daily limit, consider contacting their healthcare provider to see if that's actually safe for them. The resident misuses an OTC or a supplement, try a support plan or a medication agreement or adherence checks. If any of these fail, they might need to be evaluated or even placed in a different level of care service setting. They might need to stabilize out. It's going to be different for every patient, though. If the resident's behavior has changed since starting an OTC or supplement, engage them in a therapeutic conversation and involve their health provided as needed. There could be something where there's an interaction going on, or they might be taking a medication that has sedative effects that are increased by the OTC or the supplement. So have that conversation, see what's going on, and include the healthcare provider as needed. What's our best practices for OTCs and supplements? You want to make sure that you're listing all those OTCs, vitamins, and supplements somewhere in the residence file, or if you have a medication list for them. Again, this is for safety and completeness of the record. If you are taking a multivitamin and you go to take an antibiotic, you might limit the effectiveness of that antibiotic, because certain minerals like calcium, it actually will bind to that antibiotic and it will not absorb into your body. So if you do not have a full list of what the person is taking, then it could actually limit the effectiveness of their medication regimen. You make sure that you're observing all these supplements and OTCs unless it's inappropriate to do so. So, for example, anything that's applied in private or to the genital areas, document every time an OTC or supplement belonging to the resident or the house is taken on a medication sheet, medication administration record. Remember to store those securely in the medication room. Let's remember that staff are expected to handle all OTC drugs, vitamins, and supplements with the same care and attention to detail as you would prescription meds. Any OTC or supplement has a potential to cause harm, so let a supervisor know right away. If you suspect that there's a safety concern or a barrier to treatment, and then supporting safe and appropriate use of OTCs and supplements is a very important part of self care and long term recovery. So, making sure that people still have access to these. We are also going to have our normal congregate care call from 9 to 10 on Thursday, May 13th, with any questions you might have. And I think now we will open it up to questions.